Well, thanks, Jonathan. It really is an honor to stand here today. I am so struck by the quality of the folks who are in this room, looking out and seeing so many of our community partners. But what I'm also struck by in looking out is seeing how many of our unbelievably top-notch clinical staff are here today from St. John's Medical Center. I know that when I walk down the hallways in St. John's every single day, I am really in awe of the clinicians that surround me. And so I really just want to acknowledge all of the St. John's Medical Center people who inspire me every day in their quality of care. So I'd like to give them a round of applause. And hopefully they will identify themselves to you today as well, because they're not all in scrubs today. I'm also very honored to stand here today with one of my incredible employees. As our department has grown in the last 4 years, I really credit the success of our program to my phenomenal employees. And so one of them today is Sarah Salo, who's joining us. Well, oftentimes when I say I'm the director of the wellness department, people ask me, what do you do? And so we compiled this slide to show you a little bit about what we are doing in the department at this time. So I just want to do a quick run through on some of our major programs, and then also brush upon what really is wellness as we conceptualize it today. In our St. John's Medical Center Wellness Department, we have worksite wellness programs that we administer for over 1,300 Teton County employees. And that includes all of the employees of St. John's Medical Center, the school district, and the Teton Science Schools. We are in year 4 with our own employees, year 3 with the school district, year 2 with the Teton Science Schools. And I'll let you know that in amongst all of the busyness of this last week, we received the cohort results tracking truly the metrics of wellness in those populations. And those populations literally bring tears to my eyes with the strides that they have taken to really improve wellness in their lives. It's really, really incredible to see the differences, even just within 1 year at the science school, 2 years at the school district, and now we're in, of course, year 3 of following that cohort at St. John's Medical Center. Right here, we have one of my favorite photos of all time. It's Rachel Green, who works in our department, giving one of our beloved Teton Science School employees his $10 bill for filling out our health risk assessment. So that's what we have going on there. As part of our wellness program, we have free yoga classes that we offer to all of our worksite wellness clients. Folks will be happy to hear that we are going to move out of our chapel eventually. And we are in the process of raising money right now for a wellness corridor. So talk to John Gettler at the foundation about any questions you may have about that. In addition, we have been incredibly fortunate in the wellness department to have the support of some local donors, a few of whom are here today. Truly, our success has been entirely determined by them. They started the seed of this movement in this community, and they continue to fund it. If you know who they are, please, please acknowledge them and thank them. They are the reason why we stand here today. And they're also the reason why we are able to have the Healing Touch program that we have, that we administer to inpatients at St. John's Medical Center, as well as some of our oncology outpatients. And the reason why we can bring world-class speakers like Daniel Goleman to the community and subsidize your tickets to see someone like Daniel Goleman. If you don't have your tickets yet, they are almost all sold out, and he's speaking at the Center for the Arts on May 15th. In addition, if you haven't had a chance to read our front page coverage last week in The Planet, it is, again, something that brought tears to my eyes, reading about some of our own St. John's Medical Center employees who are taking enormous strides right now to increase wellness in their lives and running and walking a 5K for the first time in their lives. It's well worth the read. And if you didn't get a copy, of extra copies at the Wellness Department. And then last, but certainly not least, we have Healthy Teton County, and that's what we're going to be focused upon today. I've lived in Jackson for 11 years now, and I would say that the partnership that we've established with public health over the last 18 months is something that has really taken my breath away. I look back on the way the relationship stood even a decade ago, and I'm not certain that that partnership could exist. So we are so delighted to be able to work in partnership with them, and we are looking forward to moving forward together and continuing the collaborative approach to public health that we started with this process. So Brian did a fabulous job about really hitting upon these points, and they were echoed by Lou, so I'm going to move through them very quickly. As a wellness director, I am ecstatic that the needle is shifting in healthcare to really focusing upon disease prevention versus financial benefit coming from hospitals and various other healthcare institutions benefiting from people being ill. One of the big things that I think about a lot when it comes to wellness is that we really have an incredible job, because we are able to work with people to improve their quality of life. And that just means that our job's pretty easy when it comes down to it, because most people actually do want to improve their quality of life. What I'm ecstatic about is that healthcare is starting to embrace that, and that healthcare is really looking at everything from the social determinants to health to how can we improve things like access to care. As many of you also know, I coordinate the Affordable Care Act navigation for the hospital in partnership with some of our phenomenal partners at Teton County Library, some of whom are here today. And I also have been a tremendous fan of the fact that the Affordable Care Act has really held the feet of institutions like St. John's Medical Center to the fire when it comes to looking at preventive care and actually being accountable to their communities. So how are we accountable to you? Well, fortunately, there's another factor in the equation, and that is the IRS. And as many of you know, the IRS, to a certain degree, is the balancing scale when it comes to the Affordable Care Act. So basically, when the Affordable Care Act was passed, St. John's Medical Center became subject to some new IRS requirements that required us to partner with certain community organizations to complete a community health needs assessment. What the IRS requirements also required of us was to absolutely make sure that we did a comprehensive assessment of all of the various populations that exist in this community. So we embarked on this 18-month process, which Sarah will tell you more about. Personally, I am ecstatic with the product that we will be unveiling on May 13th. I think we have gone above and beyond anything that at least someone like myself dreamed we would be able to do, but also more than met all of the IRS requirements, particularly when it came to involving the voices of some of our more disparate populations in this community. In addition, as you'll see in this final bullet, St. John's Medical Center is actually required to respond to each one of the identified health needs. And so I'll be talking more about that as well.
So this really was an absolutely fantastic process to be a part of and a partner in. The framework that we used for the Community Health Needs Assessment was something called MAP, which stands for Mobilizing for Action Through Planning and Partnerships. And this is a national strategy that's used around the country as pretty much the gold standard in terms of community health improvement, community health assessment. It was developed by the National Association of County and City Health Officials. So, I mean, it was really a prime example of using evidence-based models in the community. And so there's a few really interesting components to this framework that I want to mention. And the first is that it really emphasizes community partnerships. So as Julia mentioned, this was definitely not just St. John's doing community health needs assessment, but it very much was a community health needs assessment. So we had 35 plus community partners who participated, who served on the steering committee to help guide this whole process, of which St. John's was just one. So it was very much, like I said, a community initiative. And then also, it really focused on community input as well. So not just looking at the standard quantitative data and saying, one organization saying, okay, these are our main priorities, but actually going out into the community and saying, what's important to you? What barriers do you face? How do you view health in this community? So it really took a much more broad approach to gathering community input. And the great part is that these interesting kind of diverse components of the MAP process fall right in line with the IRS requirements that Julia mentioned earlier. So the IRS actually requires community hospitals to collaborate with local public health entities. It requires local hospitals to take into consideration the interests of those underserved populations in the community. So this MAP framework really served as a great tool for moving forward. It brought us through 6 phases, and they included community visioning, assessments, and it'll move into action later on. I'm just going to focus on the assessments here for a minute. And so in terms of data collection, we really looked at 4 different areas of data. The traditional quantitative data, so morbidity, mortality, health behaviors, kind of the standard stuff that you think about. But then we also did some really interesting qualitative outreach as well. There was a quality of life survey that was done, a lot of focus groups. We also looked at broad factors, forces, events, trends that impact the health of the community on a more broad level, and then looking at the local public health system as well. So the 4 branches of the road up here signify those 4 different assessments. And once all this data was collected and analyzed, we brought it back to the steering committee. So again, the community representation, this group of 35 plus community members. And the steering committee looked at all of the data, and they're the ones who determined kind of where our health priorities lie. They looked at whether our numbers were actually statistically significant in terms of the state and national. We also looked at whether issues kept coming up in one of these 4 assessments or all 4 of the assessments. They looked at how we related to the Healthy People 2020 goals. So those are national benchmarks in terms of health performance within a community. And so they also used some other criteria, such as were there interventions available, those sorts of things, to kind of determine where the community's health priority lies. And so after this process, there was a group of indicators where we're doing really well in, and it's really exciting to see that we're doing well in. And then there were also some indicators where we do have some room for improvement, and St. John's was required to kind of focus on the ones that fit most directly into our sphere, and Julia will be talking a little bit more about those.
So as Jonathan mentioned, this is really just a sneak peek at the information that we will be sharing in far greater depth on May 13th. This was information that we did have to share with our board last week. We actually had our own St. John's Medical Center Community Health Needs Assessment and the implementation plan voted upon and approved unanimously by our Board of Trustees, so thanks a lot to the board for that. As you will see, we have highlighted 3 of the 10 identified health needs in this community, and I'm going to move on to tell you why those 3 were identified. As we look at the 10 identified health needs in this community, one of the issues that became very apparent to us, and also was something of significant discussion with our community partners, is that some of those identified health needs fit squarely under St. John's Medical Center's mission, which is patient-centered clinical excellence and community wellness, and others of those identified health needs certainly need to be addressed by some of our community partners. So the first one of the 3 identified health needs that clearly fell within our mission was access to health services. And another point that is very important to emphasize to all of you as our community members is, to a certain degree, we are responsible to you in regards to how we address these needs, and are required to annually update our implementation plan, and you are all invited to comment on our implementation plan and how we are doing on a regular basis. So we will certainly be disseminating information about how those comments are best taken. So the 2 areas that we intend to focus on during the next 12 months will be Affordable Care Act navigation, which Joe, one of our Board of Trustees, did a phenomenal job about talking about how Teton County has been fortunate in the last 2 years to literally have the highest number of signups in Wyoming for the Affordable Care Act marketplace. This is something that is a result of a strong partnership between Teton County Library. I know a couple of the navigators are here today. You can see Kurt back there and Diana Eden. They have played a really, really important role in this. So thank you so much to the Teton County Library for all of your work on that. I'm also happy to say that the navigators that we work under out of Cheyenne selected Teton County to be the location, even though, as we all know, we are not centrally located in this very large state, for our annual debrief that is going to occur on May 12th. And they said they selected us because they saw us as the model for the rest of the state on community collaborations and also having high enrollments. This other bullet is something I am very passionate about. We are in the process of developing a pilot program really touching upon some of the stuff that Brian mentioned in his talk, of really working with our patients to improve health system navigation. We are working with some critical community partners on this. We have the support of the foundation on this. So watch for more information. It will start as a small pilot program that most likely will be focused upon patients who end up utilizing our system more than most and have a challenge with managing a chronic disease. In addition, the second area that we intend to focus much of our work on is increasing rates of routine screenings. Interestingly, we still have some work to do on this here in this community. So we've worked very closely with the Department of Diagnostic Imaging at St. John's Medical Center, with some of our surgeons in physician services, and with our diabetes education department to develop a plan for increasing screenings, and then also, just as importantly, have worked exceptionally closely with the St. John's Medical Center or St. John's Hospital Foundation to really look at how we can break down barriers when it comes to financial issues people may be dealing with when it comes to routine screenings. And then the last area that we intend to focus our attention upon and our work upon is really increasing the percentage of patients who are over the age of 65 plus receiving certain immunizations. These were immunizations that, as Sarah mentioned, were identified as statistically significant in the sense that our population is not actually receiving those immunizations at as high of a rate as we would like. We absolutely intend to work very closely with our community partners that are engaged with this population, the Senior Center, Teton County Public Health, and some of our other local community partners that have been so pivotal in this process so far, and also really are the ones who are working on the front lines with the senior population locally. I wanted to get back to this slide. This was actually something that Jonathan touched upon at the beginning. This is actually just a few of the organizations that were partners for us in the Healthy Teton County process. And I really sort of narrowed down onto the ones that had played a role in some of the meetings, played a role in gathering some of the data. Again, the point of this is that communities are going to be the only way that we are going to solve access to health care. And we understand that the hospital has a very large role when it comes to access to health care, but we also realize that there's no way that we will be able to address all of the identified 10 needs unless we work hand in hand with our community partners.
So you just heard about how St. John's is responding to 3 very specific issues. The community as a whole, the Healthy Teton County Coalition, is also working to address all of these issues, as well as continue to improve on the things that we're doing well in. And so there's a couple of things going on. The first is that we're developing a community health improvement plan. And so this really highlights the community partnerships. St. John's is just one partner in these large community health improvement plans. So there are a number of organizations who are taking the lead on various issues, and they'll be putting together specific strategies, specific goals on how to address these. And you can learn more about this again on May 13th. And then also, actually, can you go back, Julia?
Sure.
And so then we'll also be creating these community coalitions. So as Julia said, we're taking the lead on those three, or in partnership with public health in terms of immunizations. For the other issues, we will be partners in coalitions. We will be doing what we can as an organization, but it's really about the community coming together, discussing and deciding what strategies work best for the community. And so all of this information will be available on May 13th. If you guys haven't heard enough, there are little cards on everybody's table that say May 13th. It's at Teton County Library. This is where we'll be fully unveiling the Community Health Needs Assessment document. You'll be able to talk to the people who have been involved in this whole process to learn more about it, look at the data, sign up for action committees, kind of really get a sense of what's going next, because this is a project that's ongoing, it's iterative, it's something, to Brian's point, that we really have a shared interest in. St. John's has specific issues that it's working on, but we also have the shared interest of the community as well. So please, we encourage you to take one of these home and then join us on May 13th for more information.
Excellent. I also just want to add that Sarah has done an absolutely extraordinary job. The full document, the full Community Health Needs Assessment, is over 130 pages long. It will be posted. There will be a link on the St. John's Medical Center website, I believe also off of the Teton County Public Health website, and of course will be listed on our healthytetoncounty.org website as well. It was interesting yesterday afternoon when we met with Jonathan. He asked us to all think about what our one takeaway was from our presentation. And I've been so struck today that pretty much Brian, Mike, Lou, and now I'm going to say Sarah and myself all came up with the exact same takeaway. But really that in a community like Teton County, in a small community like Teton County, with, in some ways, very limited resources, even though we have tremendous wealth, the only way we are going to move the needle on public health and improving our quality of life and improving wellness in this community is going to be if we all work together. There are definitely going to be challenges along the way because we all have our own organizational agendas. But I really firmly believe that that is going to be the only answer, and I am so excited to continue to partner with so many of you as we move in that direction. So thanks so much.